invest in taking care of your skin. It is definitely going to boost your self-confidence. Very good evening, viewers. Welcome to an exclusive health talk, BMC Global Live AL-HILAL Health World. Myself, Marina Francis. Most of us, I think, including children or adults, all of us, before going out, we look at the mirror, we try to keep our face as pleasant as possible, isn't it? Even in these times where we wear masks, we still look at the mirror. And acne is something that irritates us, that disturbs us in this regard. Our topic for today's discussion is acne vulgaris. And we have a very apt person today with us to talk to us about the topic. A consultant dermatologist with over 11 years experience, Dr. Evangelyn Singh, Nallapalli. She has completed MBBS and MD in dermatology, venereology and leprosy from Christian Medical College and Hospital, Vellore. She has worked as consultant dermatologist in various hospitals in India and in Bahrain. Currently, she is working at AL-HILAL Hospital in Manama branch. So let us hear more from her about how to manage acne. Good evening, doctor.
Good evening, Marina.
Welcome to AL-HILAL Health World.
It's a pleasure for me to be here this evening with you.
Thank you, doctor. Same here. Doctor, the topic for today we have taken is acne vulgaris. We have heard of pimples, we have heard the term acne. Could you elaborate to us what is acne vulgaris?
Definitely. Today I'll be talking about acne vulgaris, which is the commonest form of acne.
Okay.
So acne is the medical term for pimples,
Okay.
and vulgaris is a Latin word which means common. So acne vulgaris is the commonest form of acne, and this is seen affecting the adolescent age group, which is 13 to 19 years.
Okay.
85% of us would have suffered from acne in adolescence.
Yes.
During adolescence, the acne usually involves the T-zone of the face. The T-zone includes the forehead, the nose and the chin.
Yes.
It can, however, be seen on the chest, shoulders and the back.
Okay.
Acne can even be seen as early as 8 years of age, where it may be the first sign of puberty.
Okay.
So according to the American Academy of Dermatology, 85% of us suffer minor acne between 12 to 24 years of age.
Okay.
And it can affect males and females of all races and ethnicities.
Okay. Doctor, what could be the factors, the major causes that contribute to acne formation?
Well, there is an interplay of several factors.
Okay.
First and foremost being a genetic background, a strong family history of acne.
Okay.
The other factors include hormonal imbalances, stress, use of medications like oral steroids, use of hair cosmetics which are oily or greasy in nature.
Okay.
Certain hair products also can cause acne, and usually the acne that is seen associated with hair products is on the forehead, and this is known as pomade acne.
Okay.
Then sometimes acne can be seen due to frictional or mechanical effects, such as acne seen on the chin and the shoulders due to use of chin straps and shoulder straps by certain athletes and boxers.
Okay.
So these are all the different factors that play a role in the formation of acne.
Okay. Doctor, what could be the mechanism of acne formation?
Yeah, so I'll be talking about where does acne start.
Okay.
So acne starts in the pore. Pore is a common term for hair follicle.
Okay.
So hair follicle is the place from which the hair arises, and closely associated with the hair follicle is the oil gland, also known as the sebaceous gland.
Okay.
And normally present on our skin surface is a bacteria which is known as Cutibacterium acnes. So what exactly happens in acne formation? There are 4 major steps.
Okay.
So step number 1 is increase in oil production. So under the influence of hormones, these oil glands or the sebaceous glands, they secrete a lot of oil. They become large in size and they secrete a lot of oil.
Okay.
The second thing that happens is there is increase in keratin production. Now what is keratin? This is a normal protein that is found in skin. But under hormonal influences, this keratin production also is found to have been increased.
Okay.
So now this causes the skin cells to stick to one another. So the increase in oil production as well as increased stickiness between the cells forms a plug, and this plug will block the pore. So the bacteria which is normally present in the pore gets a perfect environment to grow, to proliferate, and this sets up an immune response leading to inflammation. And this is how we get those red, unsightly bumps on the surface of the skin which are not so pleasant looking.
Yes.
And then sometimes these large bumps can also develop when the smaller bumps join together because there is increased inflammation. And this causes the pore to rupture or to break open. And then there is a lot of inflammation in the other deeper layers of the skin. I just have a picture to show that, if I could.
Sure, doctor.
So in this picture, as we have seen, there is increase in the keratin production, and then there is increase in the oil secretion which causes the cells to stick together.
Okay.
And then what happens, this plug of cells which is sticking together, the plug that is formed by the cells which are stuck together along with the oil will block the pore.
Okay.
And then, as I said, the bacteria grows and proliferates and causes inflammation. And when the inflammation exceeds, it just breaks the wall of the pore, and then there is inflammation in the deeper layers of the skin.
Okay. Doctor, along with the commonly what we call as pimples, something else that irritates us is the black heads or white heads, certain black spots on the face. Do they come under acne, or in common to ask, what are the type of lesions that can be seen in acne?
Sure. So the types of lesions in acne have been classified as non-inflammatory and inflammatory.
Okay.
Now, what you're talking about, the black heads. So actually that is a comedone. So what is a comedone? It is the first lesion that we see in acne.
Okay.
And comedone is nothing but a plug of dead skin cells sticking together along with the sebum or the oil.
Okay.
So this is what a comedone is.
Okay.
Now comedones are of two types. We have the black heads and the white heads.
Okay.
So black heads appear black not because of dirt, which people generally think it is, but it is because the contents within the pore are exposed to the air.
Okay.
So it gets oxidized and therefore it turns black.
Okay.
But in the closed comedone or the white head, the contents are not exposed to the air, they are deep within the pore and therefore they remain white.
Okay.
Now talking about the other lesions in acne, we have the papules, which are just red painful bumps on the surface of the skin.
Yes.
Sometimes we see white tops to these red bumps, and these are pus collections, and this is a pustule.
Okay.
Now these red bumps, smaller ones, can join together and form large red bumps, which are the nodules.
Okay.
And sometimes there is pus collection in the deep layers of the skin, and that is what forms the cysts.
Okay.
So usually the scarring that we see in acne is mainly because of the nodules and the cysts, which are the deep-seated lesions in acne.
Okay.
Now the other things that we see on the face of a person with acne is a lot of pigmentation, a lot of scratch marks because they have popped or squeezed their pimples.
Yes.
So these are all the lesions that we see in acne.
Okay. Doctor, you explained about the different types of acne.
Yeah.
Also, how acne is formed.
Yes.
So, our main problem is always how to manage this acne. And definitely, there are people who pop the acne when they appear, and many unscientific ways of just getting rid of it. So, how would be the proper medical scientific treatment to manage acne?
Yeah. So before going to the management, I would just like to show a picture which shows the different types of lesions that I just discussed.
Okay.
So the first picture shows the whiteheads.
Okay.
And or the closed comedones.
Okay.
The next picture shows the blackheads or the open comedones.
Okay.
And the third picture shows a lot of redness and lot of pus. So this is the papules and the pustules.
Okay.
And then we have larger lesions which shows the nodularity, the nodules, and also the cysts, which are deep lesions.
Okay.
Now talking about treatment for acne, which you just spoke about, the treatment is aimed to control the oil production. As we have seen that increase in oil production is one of the major factor for acne formation. Okay. So there are certain medicines which help to reduce oil production, and these are known as retinoids.
Good.
So retinoids are synthetic vitamin A derivatives, and these are available in the form of creams and gels and even tablets.
Okay.
The cream that we normally use is acrotin, the gel that we use is differin or adapalene, and the
Okay.
tablets that we use is isotretinoin.
Okay.
It is under the brand names of Roaccutane or Accutane.
Okay.
So, what is the function of these retinoids? They reduce oil production by decreasing the size of the oil gland or the sebaceous gland. So, there is shrinkage of the oil glands, thereby the oil production is reduced.
Okay.
They also help to inhibit the growth of the bacteria which is responsible for inflammation,
Okay.
and they help in the skin cell maturation.
Okay.
So, by all these mechanisms, these medicines help to reduce oil production. It has also been found that niacinamide also has a role in reduction of oil production and is effective for the same.
Okay.
Now I'll be talking to you about medicines which are antibacterials and those which have anti-inflammatory properties.
Okay.
So coming to antibacterials, we have again in the form of creams and gels and lotions and tablets.
Okay.
So these antibacterials help to reduce or inhibit the growth of the bacteria that is causing inflammation.
Okay.
So examples of such antibiotics are doxycycline, azithromycin, clindamycin.
Okay.
And then we have a medicine called benzoyl peroxide.
Okay.
This is a very useful medicine. It has oxidant properties, anti-inflammatory properties, and it helps to inhibit the growth of the bacteria.
Okay.
The advantage with benzoyl peroxide is that it prevents resistance to the bacteria. So it is very useful when we use it along with antibacterials like clindamycin. Then I'll be talking to you about the other type of medicines which help to exfoliate the skin. So these are classified as alpha hydroxy and beta hydroxy acids.
Okay.
Examples of which are glycolic and salicylic acids. I'm sure you would have heard of these names before. So
Yes,
these are
yes.
present in the form of washes, and the way they help is they reduce the stickiness between the dead skin cells.
Okay.
So this enables the dead skin cells from leaving the surface of the skin easily instead of forming a plug and blocking the pore.
Okay.
So that is how they help in exfoliation.
Okay.
So these are all the medicines that we use in the treatment of acne as part of standard treatment protocol. Apart from this, it is very important that we use a non-greasy, non-fragrance moisturizer
Okay.
each time we wash our face. And because most of these medicines make the skin sensitive to sunlight, it is important that we use a sunscreen which is
Okay.
oil free.
Okay.
So whatever products we are using for the face, we must make sure that it is non-greasy so that it does not block the pores further.
Okay. Doctor, we do have further doubts regarding some aspects as to how to manage acne. Anyways, here we shall take a very short break. Please stay tuned. We shall be back after a tiny break. Welcome back. You're watching BMC Global Live AL-HILAL Health World. Today we are dealing with the topic acne vulgaris. So doctor, before moving on to other aspects of acne, let me ask, because most people try to treat acne on their own or just try to ignore it or just try to avoid thinking about it. But when is it that we have to visit a doctor and treat acne properly?
So Marina, talking about this is a very common thing what you have brought up.
Yes.
So many people use a lot of home remedies.
Yes.
Sometimes they use yogurt or turmeric, and many people also use tea tree oil, and people also use vitamin C serums.
Yes.
So all these things are not aimed at treating the acne per se, because we have seen how acne develops, the oil production, and it is because of inflammation. So I would say as soon as people notice a lot of bumps on their face which become painful, it is better to seek dermatologist opinion at the earliest,
Okay.
because they say that the most of these lesions can lead to acne scars which is not what we want on our face.
Yes, yes.
So the best way to treat acne scars is in fact to prevent them in the first place.
Okay.
So I would recommend seeing a dermatologist at the earliest.
Yes. Just like you mentioned, acne scars, even after the acne is gone, what keeps irritating us is the acne scars. When the scars are on our face, it definitely affects our self-confidence. So how to manage acne scars? How to get rid of them?
Sure. So I will first talk to you about the types of acne scars that we see, and then we
Okay.
will move on to the management of the acne scars.
Sure.
So the most common type of acne scar that we see on the face is the flat scars, which may either be red or brown or black.
Okay.
And this is usually the result of picking the pimples or popping or squeezing them.
Okay.
So these scars are on the surface of the skin.
Okay.
And then we have two other types of scars which are called depressed scars and raised scars.
Okay.
So depressed scars are those which are below the level of the skin, and they are again classified as ice pick scars, box scars and rolling scars.
Okay.
So the ice pick scars are the real sharp pointed scars which go deep into the skin, and then the rolling and the box scars are a little shallow, not very pointed.
Okay.
And then we have the raised scars, which can be hypertrophic, that is a lot of scar tissue there, and also keloidal.
Okay.
Again, a lot of scar tissue above the surface of the skin.
Okay.
So then how do we manage these scars? So the treatment for the flat scars, which is the result of picking, popping or squeezing as I mentioned earlier, is with the topical retinoid creams that I discussed earlier.
Okay.
So these actually help to improve the cell regeneration and help to reduce scars.
Okay.
And then we have the alpha and the beta hydroxy acids, that is the glycolic and salicylic acids. They also help to exfoliate or remove the dead layers of the skin and thereby help in treatment for these superficial scars.
Okay.
Now for the raised scars, there are different methods to treat. We can give injections into these scars, and these injections are usually of steroids, and therefore they are called intralesional injections.
Okay.
They help to flatten these scars with time.
Okay.
And the other thing that can be used are certain dressings which are impregnated with silicone, and silicone actually hydrates the skin and also helps to make it supple and soft.
Okay.
And then I'll be talking about treatment for depressed scars.
Okay.
This is rather challenging, and there are different methods that we have to treat in order to treat these depressed scars. So the first method is by skin resurfacing.
Okay.
So what is skin resurfacing? Basically, it is removal of layers of skin in a controlled fashion, thereby enabling collagen remodeling and
Okay.
development. So this is done in three ways. We have the ablative methods, the minimally ablative methods, and the non-ablative methods.
Okay.
So in ablative methods, as I said, it is controlled removal of layers of the skin superficial to deep, that is the epidermis and the dermis.
Okay.
And this in turn helps in dermal remodeling, that is the remodeling of the deeper layers of the skin, and also in new collagen formation. So once a new collagen formation takes place, it helps to treat or level out these scars.
Okay.
So the ablative methods that are used for resurfacing are through medium depth chemical peels. So these are acids applied on the skin which help to remove the layers of skin in a controlled fashion.
Okay.
And then we have something called dermabrasion, which is again the same thing, removing layers of the skin in a controlled manner, and this is done either using an electrical dermabrader or a manual dermabrader.
Okay.
And then we have certain types of lasers which are called ablative lasers. So these also help to remove the layers of the epidermis and the dermis, that is the superficial to little deeper layers of the skin, and help in collagen modeling and dermal remodeling.
Okay.
Then we move on to the minimally ablative methods. So in the minimal ablative methods, there is only superficial abrasion of the skin. So only the top layers are affected.
Okay.
The deeper layers of the skin are not affected as much, and this in turn helps in collagen formation.
Okay.
So this is done with the help of certain abrasive materials like aluminum oxide crystals. So when they're applied on the skin, they will help to remove only the superficial layers of the skin.
Okay.
And this in turn stimulates new collagen formation.
Okay.
And then we have non-ablative methods. This again is done by certain lasers. This will affect the deeper layers of the skin without injury to the superficial layers of the skin. In turn helps in collagen remodeling. Then the other treatment options are something called microneedling. It is a method of collagen induction. Here we have a roller which is handheld and this has a lot of needles. It can also be done with something called a derma pen.
Okay.
So these needles penetrate through the epidermis and they affect the deeper layers of the skin without removal of the superficial layers.
Okay.
And this again helps in new collagen formation. And then there are certain surgical methods like punch excision and subcision. These help to break the extra fibrous tissue that is causing these scars.
Okay.
Sometimes fillers can be used to treat certain scars. And then there is another method called skin tightening. This is done with radio frequency. So when you tighten the skin, you eventually help to even out some of these scars and treat them.
Okay.
So these are all the different methods that we used for treatment of depressed scars.
Okay. Doctor, you explained in detail the various methods used in treating acne scars. Now, doctor, one common question that comes up is when you talked about the causes that lead to formation of acne, does diet affect the acne formation? It's always a common doubt because you said oil formation on the skin.
Yeah.
So, is it does oily food increase the formation of acne? Those are common doubts among especially teenagers. Could you address that?
Yeah, sure. That's a very good question. So does diet affect acne? Yeah, there is mixed evidence to show that certain diets do affect acne.
Okay.
In fact, some Canadian studies have shown that increased consumption of refined carbohydrates, soda, and dairy products can actually worsen acne. Also, it has been shown that increased intake of cocoa can worsen acne.
Okay.
According to the American Academy of Dermatology, increased intake of cow's milk may also trigger or worsen acne.
Okay. Doctor, then mostly we see acne problems in the teenage category,
Yeah.
teenage or young adult category. What about the children, younger children? Do they also get acne?
Yes, the answer to that question is yes. So,
Okay.
acne can affect children. In fact, it is classified as two types. We have the neonatal and the infantile acne.
Okay.
So, these types of acne can be seen from birth to 1 year of age.
Okay.
And they occur under the influence of maternal and neonatal hormones, androgens. But usually they settle by 1 year of age.
Okay.
So, if acne in a child is seen between, let's say, 1 year to 8 years of age, that is a cause to worry. And we have to seek the opinion of an endocrinologist to look for any other hormonal imbalances.
Okay. Doctor, mostly after a person reaches an adult age, acne they subside off gradually on their own. But we see that some adults also they have the problem of acne. So how common is acne in adults?
Yeah, so acne can affect adults. Sometimes it is just the adolescent acne which is persisting into the adulthood.
Okay.
But sometimes we see acne starting for the first time in adulthood, let's say around after 25 years of age. And it can also be seen up to the fifth decade of life.
Okay.
So the acne in adults can be seen in males and females, but it is more common in women.
Okay.
And usually the acne in adults is seen affecting the jawline,
Okay.
and this is known as the U zone. Earlier I mentioned in adolescent acne that it is mainly the
T-zone.
T zone of the face,
Yes.
but in the adult acne it is the U zone, which is the jawline that is mostly affected.
Okay.
So I'll be just talking about hormonal acne in women. So in women, acne, adult onset acne is common, and this is usually seen associated with the menstrual cycle.
Okay.
Also can be seen during pregnancy, during the usage of oral contraceptive pills. It can also be seen associated with conditions like polycystic ovarian disease.
Okay.
And some women also see it around their menopause or after their menopause. And even in those who take hormone replacement therapy, acne can occur.
Okay.
So apart from acne, the other features that women present with can be gain in weight, it could be loss of the scalp hair or abnormal hair on the body or the face, and sometimes black pigmentation around the neck, which we call as acanthosis nigricans.
Okay.
They may also have menstrual irregularities.
Okay.
So how do we treat hormonal acne in women? Apart from all the standard treatment protocol for acne that I mentioned earlier, we use anti-androgens for the treatment.
Okay.
So these anti-androgens block the effects of the androgens or the hormones that are affecting the glands, making the oil production to increase.
Okay.
We also use combined oral contraceptive pills low dose, and this helps to block the ovarian androgen production.
Okay.
So thereby these two medicines play a lot of role in the treatment of hormonal acne in women.
Okay. Doctor, we started off with the topic acne vulgaris, the
Yeah.
most common type of acne. What could be the other types of acne?
Yeah, so there are a few other types of acne which I will just briefly talk about.
Okay.
There's something called acne excori. So acne excori is nothing but a lot of pigmentation, scarring that we see on the face of a person who has acne, and this is because the person has the habit of picking on the acne or popping or squeezing it.
Okay.
So apart from the medications, these people need a lot of psychological counseling and help so that they do not cause disfigurement of their face by the habit of picking the pimples.
Okay.
And then there is another entity called acne conglobata, which is a lot of large nodules and cysts that are seen on the face.
Okay.
Then there is another type called acne fulminans, which is a severe form of conglobata. Here the person is very sick, he may have fever, joint pains, sometimes there is bleeding and ulceration from these acne lesions. So an emergency or an urgent dermatologist opinion has to be sought in this condition.
Okay.
It is said that this happens due to the hypersensitivity to the surface bacteria, and therefore suddenly the person is very sick and the lesions are also very painful.
Okay. Doctor, in these COVID pandemic times, mask has become a part of our daily lives. So my next question would be, there are some people who doubt whether wearing a mask can cause the formation of acne, can increase the chances of acne. How would you address that, doctor?
Yes, ever since the outbreak of COVID-19 pandemic, there have been a lot of patients who have complained acne on the face with the usage of mask.
Okay.
In fact, it is known as maskne. So the acne associated with mask is called maskne.
Okay.
And why does it happen, or how does a mask cause acne? It is the combined effect of friction, pressure, heat, sweat retention. All of these block the pores and give the perfect environment for the surface bacteria to cause inflammation.
Okay.
So how do we take care of our face in these times?
Yes.
So there are certain things which we should remember, and that is that we have to change our mask every day first and foremost. If we are using a cloth mask, it has to be washed every day, and then we should avoid putting makeup, and also we have to be sure that whatever moisturizer we use is non-greasy,
Okay.
and better to use cotton masks or natural fiber masks.
Okay.
Now the acne that is seen associated with the mask is usually seen around the mouth and the nose, and this is the O zone.
Okay.
So I'll be just showing you the patterns of acne. As I mentioned earlier, T zone is for the adolescent acne,
Okay.
U zone is for the adult onset acne, and O zone, which is around the mouth, is for the acne related to the usage of masks.
Doctor, my next question is regarding the skincare regimen that we have to follow in our life, daily in our lives. So most of us try out different moisturizers, sunscreens, but we are not sure whether it is really helpful for our skin. We just keep trying different products to arrive at one product. So how would you help us in identifying some good skincare for routine that we have to follow?
Yeah, so I'll be just talking about the general skincare regimen that needs to be taken. So
Okay.
first and foremost, we have to be gentle with our skin.
Okay.
We must remember that we should not wash our face several times in a day. because doing so will remove the natural oils from the skin, and this will in turn worsen acne.
Okay.
So we can wash our face maybe twice a day,
Okay.
and the face wash or cleanser that we use should be skin pH balanced.
Okay.
We must avoid excessive rubbing or scrubbing or use of abrasive materials or materials that feel harsh on the skin.
Okay.
We must also avoid use of alcohol based astringents or toners.
Okay.
Then we must remember to wipe our face with a clean towel each time.
Okay.
If we use hair products, we must remember that we change our pillow cover at least once or twice in a week.
Okay.
And then whatever preparations we are using for our face in the form of a moisturizer or a sunscreen, we have to make sure that it is mentioned won't clog pores or non-comedogenic on them.
Okay.
And we must also remember never to sleep in makeup. It has to be removed and our face has to be cleaned.
Okay.
And especially now when we are using the mask, as I mentioned earlier, we have to change our masks every day and wash the cloth masks on a daily basis.
Yes. Doctor, for those people who regularly have to wear makeup, probably for their job or for functions, do you how to take care of skin in such scenarios? Should we wear a protective layer before wearing on makeup? How do you suggest that?
So makeup, if it has to be worn, it has to be mild, and a moisturizer has to be used, because direct application of cosmetics or makeup actually can cause more breakouts.
Okay.
So the moisturizer should be non-fragranced, non-greasy, and then makeup can be applied, but it has to be careful that it is not a very thick application of makeup, because the occlusion effects can actually worsen acne.
Okay. Doctor, another common question, common doubt all of us have is, can we use soap to clean our face? Is it good or is it bad? It's always a doubt.
Soaps can be used to clean our face. In fact, there are certain soaps which are skin pH balanced, or even face washes for that matter. So those can be used to clean our face. But having said that, too much of rubbing and scrubbing should be avoided.
Okay, okay. Doctor, you spoke about many aspects, many scientific aspects behind acne. We would like to have a summary of all that as a takeaway message for our viewers.
Well, the take-home message for all of us is that acne vulgaris is the most common form of acne.
Yes.
This is seen in adolescence.
Okay.
Sometimes adolescent acne can extend on into the adulthood.
Okay.
Acne can also be seen in children. Then we must be very gentle with our skin.
Okay.
We must avoid popping or squeezing the pimples.
Okay.
The best way to treat acne scars is to prevent it in the first place.
Okay.
And then we must always seek the dermatologist opinion at the earliest.
Okay. That would have definitely been a very informative episode for all of you viewers there, especially the teenagers struggling with acne. And I think doctor has covered all types of acne that is common among us. Thank you very much, doctor, for joining with us in this episode. We are very happy that you joined with us. So until we meet again next week, same day, same time, this is Marina Francis signing off. Stay happy, stay healthy. Good night.